This program is a Warren Steibel production in association with South Carolina ETV. Funding for Firing Line is made possible by a grant from the John M. Olin Foundation, the Annenberg Foundation, the Laurel Foundation, the Friends of Firing Line, and the people of Glaxo. In the relentless search for answers and medicines, on the brink of discovery, Glaxo, Research and Medicines.
We've gathered together many luminaries to examine the healthcare question in this and 3 succeeding Firing Line programs. Inevitably, there will be a degree of helter-skelter with so many voices contributing their insights, every one of them unique, to analyzing the great social question of the day. To help impose order and attempt a rewarding narrative line, we've done 2 things. The first is to devote the first 2 programs to an examination of the structural question. What should the architecture of a health program look like? The second is to engage the special services for all the programs of someone who has devoted most of his time in recent months and years to a study of the question at hand, Dr. John Goodman. He is the president of the National Center for Policy Analysis, a Dallas-based public policy research institute. He's a PhD in economics from Columbia and has taught at 7 colleges and universities and written 7 books. His most recent, called Patient Power, Solving America's Healthcare Crisis. I shall rely on him to help guide the discussion. In the first 2 programs, we have 5 other critically important guests. I introduce them in alphabetical sequence. Congressman Jim Cooper, a Democrat of Tennessee, is a leading congressional advocate of the managed competition model of healthcare reform. As a member of the Health Subcommittee of the Energy and Commerce Committee, he will be the main Democratic voice in the House for market-based reforms to our healthcare system. He's a graduate of the University of North Carolina, a Rhodes Scholar who studied obviously at Oxford, and a graduate of the Harvard Law School. When elected to Congress in 1982, he was the House's youngest member. Jackson Farris is president of the National Federation of Independent Business, the country's largest small business advocacy organization. He's a graduate of Lipscomb University, was executive director of the Republican National Finance Committee for several years, and strives to keep the socialist dogs at bay.
God bless you.
Senator Phil Gramm was once a Democrat, but strives to make up for his youthful extravagances. He won election to the Senate in Texas in 1984 as a Republican with the largest vote ever recorded there. He is, of course, the author of the Gramm-Rudman bill, a member of the Budget Appropriations and Banking Committee, a PhD in economics from Texas A&M, where he taught, and the author of several books, including The Role of Government in a Free Society. Walter Zelman is the principal healthcare advisor to the Department of Health and Human Welfare. He's a graduate at the University of Michigan, did graduate work at the London School of Economics, and got his PhD from UCLA in political science. Finally, Pete Stark is serving his 11th term in Congress, where he has been chairman of the Health Subcommittee of the Ways and Means Committee. He's a graduate of MIT with a degree in engineering and a master's in business administration from the University of California in Berkeley, who was an entrepreneurial banker until he went to Congress. He's widely known for his interest in tax reform and for playing a leading role in the '86 tax reform law. I propose, as I say, to endeavor to ask questions that give us some idea of the structural alternatives, and I will leave it to Dr. Goodman to interrupt and to seek clarifications whenever he is prompted to do so, or for that matter, any of you. I begin by asking Congressman Cooper, why your enthusiasm for managed competition?
We think that market-based reform will work far better than government takeover of health care. Even though every other nation has already chosen government takeover, we think there's got to be a better way, because Canada, Germany, other nations are experiencing real problems in their health system. We think that by allowing the marketplace to work, real competition, not complete absence of government, but government in there to set a level playing field, and then to allow the competitive forces to go at it, we'll do a better job of putting the customer, the patient, first, and that's the goal of any real healthcare system.
Well, Germany, England, and Canada have, of course, free health care and spend less per capita than we do under our private enterprise system. How do you account for that, given the existing competitive patterns?
Well, they spend less, true, but they have inferior systems. If you're a resident of one of those countries, you prefer to get your care from the United States if you can get to this country. They have some advantages. They do have universal coverage, and they're to be congratulated on that. We need to have everyone in this country covered with a sensible health policy. But the costs are increasing just as rapidly in these other nations. They have long length of stay in hospitals that are unnecessary. There's lots of waste and inefficiency in those systems that should be rooted out. Market reform is the best way to do that.
Well, Dr. Goodman, what's your quarrel with managed competition, or do you have one?
Well, the question I have is that what the Clinton administration is still in favor of? Now, the Jackson Hole health policy analysts, who are the architects of this idea and who shaped the original Clinton proposal, have now completely disassociated themselves from the administration's health plan because the administration has abandoned competition and gone in the direction of global budgets and price controls. So my question to Dr. Zelman is, haven't you really abandoned competition? Aren't you now trying to impose something like the Canadian system on the American people?
No, we are imposing a system, we're proposing a system in which there will be maximum competition, maximum choice for all individuals, and competition between private health care plans and a reformed insurance market, as the Congressman suggested. All insurance companies, all HMOs, all networks of doctors and hospitals and nurses will have to put forward a price and compete on quality and service, and every individual will have a choice of the maximum number of plans, unlike today's situation, in which fewer and fewer individuals are getting a choice of health care plans or doctors and hospitals. Under the new system, everyone will have a choice, everyone will be guaranteed care, and it will be a private market dictated by market mechanisms in which health care plans compete on price, quality, and service, and not how they compete today. They compete today on how they select risk and how they get the higher risk individuals out of their pool and the better risk individuals into their pool.
As a matter of form, shouldn't we use the subjunctive would rather than will, right? We wouldn't be having this discussion if we knew that these proposals were going to be enacted.
We're confident that when everybody understands all the proposals and debates all the proposals, they will see that this is a good compromise in terms of taking the best from different systems, from those like Mr. Stark, who would advocate a heavier government dose of regulation, from those like Mr. Cooper, who would advocate a heavier dose of private market interventions. We think this is a very good cross, and we think this will really get the American people the choice they want and the care they want and the security they want.
He has an anarchist streak in him, doesn't he?
Well, isn't the real problem? The Clinton bill would allow any state to pick the single-payer approach, the Canadian approach, but it really allows no state to go manage competition, the real market-based approach. That's why all the leading Jackson Hole spokesmen have forsaken the administration's approach. They've given up hope that the administration is going to endorse real managed competition, because so much of your plan is the draconian global budget or price controls.
We have what's being called here as a global budget as a backstop. We truly believe that the competitive marketplace, when restructured, when everyone is given a choice of all the health care plans, when plans are forced to compete on quality and service and on price rather than on risk selection, when administrative burdens of small employers are lifted, when administrative burdens of hospitals and doctors who are being paid by hundreds of different insurers with different bills, different rating schemes, a huge paper chase, when we streamline this system, we will make the budget targets in the Clinton healthcare plan without having to resort to a heavy hand of regulation. Those few alliances that occasionally don't will have to impose something.
Mr. Farris, what is your comment on that?
I think when he mentioned the cross a while ago, it's quite a cross to bear for small business owners to realize and see that what you're proposing, if in fact will work by competition, why not let it work by competition rather than starting off with a mandate? There are subsidies for small business in terms of paying We've seen with the government that subsidies come and go, but the mandates last forever. Why run a risk of having a health care system that creates a pink slip? In the name of, you're only a pink slip away from having no health care. We're for health care reform. And there are points in the proposals from most everyone here at the table that we're absolutely for. But let's get it affordable first. Let's give small business owners the opportunity to buy in. Let's give individuals the opportunity to buy in. And let's see what works with that system first, rather than having the government in the catbird seat for 15% of our economy. So far, we've not seen the government do a real effective, efficient job at running what free enterprise could run. That's a major problem for small business.
That is not so.
Sorry.
Let me be a little. I've got the only plan that works, and that's Medicare. And none of the people here would call that socialism or vote against it.
It's
And
just
the
paying for it's the problem.
And the seniors love it. All the seniors love it. The doctors like it. The hospitals survive with it.
And it's about to bankrupt the country.
Not necessarily. As a matter of fact, it is good through about 2005 or 10, which may be longer than some of these other plans will take us to pass. So where we have a plan that's working, now all these other are pie-in-the-sky dreams of something that might work. This is a plan that's working every day, 28 years. Admittedly, it's been too costly in some areas. Admittedly, there have been complaints, but doctors have learned how to cheat. We've learned how to put them in jail. Mr. Gramm and I argue about the budget each year, but we've been able to control it. It hasn't gone broke yet. It's a plan that's there. Shoot at it if you choose, but it has cost containment. It has all the features that all of these wannabes would add, but it has the advantage of it's empirical and works.
You got a problem with that, Senator?
Well, I think the problem we've had with Medicare is that we've had a very difficult time paying for it. It is an incredible paradox that we started this debate in large part because of our inability to pay for Medicare and Medicaid. The president comes out with a proposal that has a sugar coating on it that thick and promises more new benefits at a higher cost than either Medicare or Medicaid. And while I'm on the subject, let me make 2 points, Bill. First of all, we have an incredible doublespeak going on here by the administration where they talk about choices and competition, and yet health care is going to be bought by government under the president's plan. The country is going to be broken up into health care collectives. Private insurance policies, unless you work for the post office or for a company that has 5,000 or more employees, are going to be canceled. It's going to be illegal for insurance companies to sell a competing insurance policy. You're going to have to buy health care through a government agency. The government agency is going to dictate what choices are available. It's going to have the ability in the middle of the year, if costs are overrunning, to change everybody's policy, so you'll have the president's card, but it may in July not mean what it means in January, and it may not cover the same services. And this is called competition. It is said this relies on the market system.
How would your plan compete? How would your plan correct those weaknesses?
Well, basically, the problem is that we have third-party payment to the extent that when somebody goes to the hospital, somebody else pays 95% of the bill, and so price competition doesn't work in medicine. As I like to say, if I bought groceries the way I buy health care, I would eat differently, and so would my dog. Now, the question is, how do you get back in the conventional grocery store? The president says, let's have a government bureaucrat that walks along with you and helps you buy your groceries. I say, let's change the system. Let's give consumers more choices. Whereas currently, the average employee can choose only the company plan. I want to let each employee have the choice of taking the money their company's putting into a conventional insurance policy, and I want to be able to take that money and go out and buy into an HMO if they want to buy into it. I wanted to be able to take that money and buy a medical savings account.
Well, Dr. Zelman just said you would have those choices, did you not?
The problem is that Senator Gramm wants to let the individual free onto an insurance market that's largely unreformed. An insurance market where pre-existing conditions are still imposed, an insurance market where if you get sick, you get a higher price, an insurance market where if your group buys insurance and someone gets cancer or a heart disease or someone has a daughter born with a problem, your insurance goes up. We need to reform that market. Once we reform that market, then we can, as Senator Gramm suggests, give everyone the choice. But this notion that the president's plan is government-run is just fallacious, and it's rhetoric. We are setting up a system here in which there will be a health alliance, which is a cooperative of employers and employees, that will give to every individual in the region the maximum number of choice of all the healthcare delivery systems that wish to compete in that area.
It's run by state governments, Walter. I mean, it's a
Under
matter of choice. You want
federal
Ann
mandate.
Richards to run it or Pete Wilson to run it? I don't want either one of them to run it.
Why is it
but-
illegal for a private insurance company to sell a policy directly to me in College Station, Texas?
I think the reason is risk. The problem is in insurance today, and I think most people really don't understand the issue of risk. Insurance companies know that 10% of people cause about 75% of the costs. I don't say that to demean those people, but that's just the way the system works. If you're an insurance company and you want to make money, the way to do it is to make sure you get a better risk pool and that the other guy, your competitor, gets a worse risk pool. Until we change that, until we make insurance companies and HMOs and collections of doctors, hospitals, and nurses compete on the quality of care and the price of care, rather than whether or not they were able to get a better risk pool, we will not be able to reform the system. And Senator Gramm's
Bill, could I
proposal
respond
doesn't
to
do
that?
that.
Yes, sir.
Basically, the problem is, Walter, that you can't let people choose, because if they got to choose, they would not choose to buy health care through the government. Your whole plan is based on the premise that government bureaucrats who don't make any more money if they control costs, don't make any less if they do, don't make any more money if we're satisfied, don't make any less if we do, that government, which seems to run nothing well, is going to be able to reduce paperwork, is going to be able to reduce overhead, be able to reduce cost.
Bill, if I could-
60% of the paperwork in American medicine is produced by Medicare and Medicaid. Why don't we start with the government doing something about red tape and regulation? People, final point, people are going to reject the Clinton plan simply because it violates the fundamental premises on which America has been built. The right of people to choose and the belief that ultimately efficiency and economy come from competition.
Mr. Cooper?
What you've just seen is the reason America has done nothing on health care reform in 40 years, since Truman really started the debate. We've had two parties fighting each other over the best way to reform. There is a bipartisan solution in the middle. It's called managed competition. We've already introduced it in the House with 50 co-sponsors, 28 Democrats, 22 Republicans. There's a great deal of good in the Clinton plan, and we need to remember that. It has a great deal of competition, perhaps not enough to suit the senator. But likewise, he does not do enough to solve the real fundamental structural problems of our healthcare system. He does nothing for the poor and the near
That's
poor.
not true.
He does nothing for fee-for-service medicine. So we need to find the common element so we can get progress made, so we can get a bill passed that will be good medicine back home for the American people. There's an opportunity to do that in this Congress with managed competition.
What do you do for the poor?
I have a sliding scale subsidy for people that make too much money to get Medicaid and therefore aren't covered, but make too little to buy health insurance. We have a risk pool on a state-by-state basis. It only costs about $4 billion a year to provide that risk pool. We have a sliding scale assistance, but we believe giving consumers choices to make price competition work is a better way to go. So what
we
we've
agree.
had to this point is a statement by the administration and their allies, full-time or part-time, that there is no alternative other than letting government run the system. I'm against government running the system because I know it's not
Are
going
you
to work.
against Medicare, Phil?
Excuse me?
Are you against Medicare?
No,
Have you
I'm
ever...
not against Medicare, but
And
I'm saying
let me
this.
just defend those faceless bureaucrats, less than 4,000 of them, who provide all the work for 35 million Americans at about 2.5% overhead, better than any private insurance company in this country. Fewer bureaucrats working to run Medicare. We have controlled prices better than any managed care plan in the country. Admittedly, they've been shifted to private payers, but that could be stopped with other types of price control. It's disingenuous to not, to leave Medicare aside. After all, it is the largest insurance plan in this country. It has complete choice. Your mother can go to Austin or Johns Hopkins or Mayo. She can go to any doctor she chooses. She can join an HMO if they qualify for federal quality. It is the penultimate choice of medical care, and it has competition. You can have competition in the supplemental policies that you purchase, which 70% of the people do, and we now control those. So I keep coming back to say, while it's not perfect, make the case that somebody 65.
I'll be there.
No, you'll be there before I will, but why should...
been there.
Why should... why, if it's good for you, why isn't it good for me, Bill? You see, that's... Well, what is the... If Medicare is okay for you, why should I be in it?
I think the other point we have to emphasize, and again, is the question of choice. Opponents of the Clinton plan will continue to hammer on this issue that there's no choice. The truth of the matter is the Health Alliance, you may call it government, others will call it employer consumer cooperative.
Or the
it's
people
really,
that work
it's
for
up to the state.
For the government or not?
No, it's
Are
up,
they government employees?
Not necessarily. It is up to the state to determine how they structure the Health Alliance. We don't want the long arm of Washington to tell every state how to deliver its medical care. So every state can structure its own alliance. But that
I might add that
alliance...
the federal government has done a hell of a lot better job running Medicare than the states have done running Medicaid, and you might be wrong in not having the states
I suspect
continue.
that perhaps the difference there is that Medicare services the elderly who are tremendously
So does
powerful
Medicaid.
lobby, and Medicaid largely services the poor who are not a terribly powerful
But it's
lobby.
run by the states.
In
But I
either
want to
case,
see, let me
we've got
finish my
double-digit
point.
cost.
Let me finish my point on the choice. Every individual in this Health Alliance is going to get a brochure which gives them the list of every single competing plan in their area. The Health Alliance is not allowed to say to a plan, you can't compete. So you'll get Aetna and Cigna and Kaiser and Take Care and the health plan of Washington, D.C., and every other plan there is, and the individual will get information about each of those plans, how much they're going to charge, how much consumers in them like them, how they're doing on quality measures, how many people have left each plan, and why did they leave each plan. Consumers then, armed with that better information, will be able to drive a private marketplace by being able to move from year to year.
But they won't be able to go
the
to
plan
Mayo's, will they,
want.
Walter?
They will be able to go to the Mayo Clinic.
No, they will have
and
to
they
pay
will-
more.
They will be allowed to charge the fee-for-service
That's not true. They will
Medicare
not
system
be able
you
to go
want.
to Mayo's without paying a lot more money.
If they enroll in a fee-for-service plan, such as a Medicare similar
they
plan,
pay more
they will
money.
be able to go to anyone.
Congressman
Yes, they
Stark
would pay a
raises
little bit more for
a
that.
very important point here, because many viewers may listen to the plan you've described and think, well, if it doesn't work for me, I'll just take money out of my own pocket and pay more to get to see a good doctor. In fact, they will not be able to do that, will they? Because you're going to control the fees of all the doctors in the country, and people are not going to be able to pay more to see the doctor of their choice.
Why not?
Because he's got
Set
price
fees.
controls and fee schedules for all the doctors in the country. Good doctors are not going to be able to charge extra money so that patients can see them.
We think we need to protect individuals so that they know what they're going to get. In today's insurance market, your insurance company
Be
says...
protected from their own pocketbook.
Insurance companies today tell you, here's our premium, pay this premium, and we'll pay 80% of the bill.
Hey,
You
my
then go-
mom likes it, Walter.
you then-
She doesn't want you telling her where to go. She likes her doctor.
You then go to a doctor, and the doctor says, oh, yes, the insurance company paid 80% of what they thought a fair bill was. But you know something? I charged more, so now you have to pay me more. The consumer doesn't know what their price is. Under our system, the consumer is going to know what the price is, and then they can intelligently choose, do they want to buy an HMO, which may be less expensive? Do they want to buy a system in which they have ability to go to any doctor? That may or may not be a little bit more expensive. That may vary by region.
Well, it seems to me, Walter, that what you don't believe in is the ability of people to intelligently choose, because you make them buy through the government. You cancel their insurance. You make it illegal for a private insurance company to sell them a competing policy. And you talk about they're going to be able to choose and they're going to get these things, but you know, since you know your plan, that you have in the plan the ability, if you're running over budget, to go back in the middle of the year and to change the policy. And I think as people understand how your plan works, it sounded great. We're going to pay for pharmaceuticals, eyeglasses, extended care, nursing home care, drug rehabilitation, alcohol rehabilitation. We're going to pay for mental care. It just sounded wonderful. But when people realize that they're going to give up their freedom to choose, that their insurance is going to be canceled, and that their policy that you're going to sell them and you're going to set the parameters of can be changed any day, they're going to reject
It's the present system that threatens to cancel your insurance on a daily basis. It's the new system that will give you a health security card that guarantees you care for all. And I'm just befuddled by your insistence that
Is
there's
it
less
not
choice
true?
here.
Let me
Every
just ask you a
individual has
question.
the choice of all the
Can it be changed
plans.
let's say that in College Station, Texas, whatever health collective we're in, that by July we spent 9/10 of our money. Cannot the plans be changed and services be limited? The answer is yes.
No, the answer is no.
Gentlemen, we do know one thing, that there are literally millions of people who are intimidated and threatened today by this whole debate the fear of what will happen to my health care, will I have it, where will I get it, and what we're concerned about is the sticker shock. What is the price, how are each one of these systems, how they will be paid for. When I hear you say that this will be covered by people who smoke and the small business owners and savings in the system, that is of great concern when we keep talking about a top-of-the-line health care plan that will be guaranteed. And we talk about 37 million more people in the system. We talk about all these great things. Frankly, reminds me of being pulled in a Mercedes dealership and having somebody say, don't you want your family in a very comfortable car, a safe car? And then we look at the sticker. We have to have reform. The small business owners and their employees and their families have to have reform. The question is the long arm of the government going to reach down and once again, the pocketbook, the business owners to say that you and your employees and your families trust us. We're from the government. It will be more efficient, more effective, and will cost you less money.
But Jack,
we don't buy that.
Let's not exaggerate the differences here. You gentlemen know there's a great deal of good in the Clinton plan.
Absolutely. I do not know that.
You gentlemen know,
I don't know
that if we were to have genuine purchasing cooperatives, if we were
to
to cut out the employer mandate, if we were to reduce the size of the employer down to 100 or below, we would have a plan that I think we could all live with quite happily. The Wall Street Journal in today's editorial said while they might have preferred your plan in pure theory, managed competition is plenty good if we just allow it to work. So let's seek out the good in both elements. Let's pass reform for the American people. They are tired of this bickering. They are tired of this needless partisanship. It's very important to stress the positive.
And in a few seconds, I'm going to show you
We're
how
only
to do
going to
that.
get to do this once. We better do it right.
In a few seconds, I will welcome you back for the second program. Thank you.
Next week on Firing Line, the second of a four-part mini-debate about health care. Funding for Firing Line was made possible by a grant from the John M. Olin Foundation, the Annenberg Foundation, the Laurel Foundation, the Friends of Firing Line, and the people of Glaxo. In the relentless search for answers and medicines, on the brink of discovery, Glaxo, Research and Medicines. For information about a video cassette of this program, write to Firing Line, 2700 Cypress Street, Columbia, South Carolina, 29205, or call 803-799-3449. That's Firing Line, 2700 Cypress Street, Columbia, South Carolina, 29205. Or call 803-799-3449.